Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Let's start today's topic. Today we are going to talk about dysfunctional uterine bleeding. It's a condition affecting female. So let's start. Dysfunctional uterine bleeding or DUB is abnormal uterine bleeding without an obvious structural cause like fibroids, polyps, or cancer. Today, doctors more commonly call this abnormal uterine bleeding due to ovulatory dysfunction. Okay, what does it look like? What does dysfunctional uterine bleeding or DUB presented as? Women with a DUB may notice very heavy bleeding or very heavy periods soaking the pads every 1 to 2 hours. Periods lasting more than 7 days, bleeding between periods. Skipped periods followed by very heavy bleeding. Irregular cycle length. These are the symptoms of dysfunctional uterine bleeding. Why does it happens? Most often it happens because of the hormonal imbalance, especially when the ovulation does not occur regularly. Common causes are anovulation or no ovulation, very common in teens and menopause time. Polycystic ovarian disease or polycystic ovarian syndrome, thyroid problems, stress or extreme weight changes, perimenopause, obesity, certain medications, etc. When ovulation does not occur, what happens is progesterone is not produced. Estrogen keeps thickening the uterine lining or inside of the uterine wall. The lining of the uterine wall become unstable and which leads to heavy irregular shedding, and that causes the irregular or heavy bleeding. Okay, now let's look into how doctors evaluate this condition. Doctors rule out other causes first, like doing pregnancy test, pelvic exam, ultrasound, blood test for ruling out thyroxine or hemoglobin. Sometimes they do endometrial biopsy, especially women aged more than 35 years, for ruling out other risk factors. Now let's come to the treatment options. Treatment depends on age, severity of the condition, and whether pregnancy is desired. Number 1 is hormonal treatments, combined birth control pills, progesterone tablets, hormonal IUDs like Mirena, etc. are treatment options in hormonal treatments. Now let's come to non-hormonal options. Now we have other option called non-hormonal options with some pills prescribed for this condition. For severe cases, endometrial ablations and hysterectomy are done. A hysterectomy is the last option in this condition. Okay. So when it is emergency or when you should seek an attention immediately. Seek urgent medical care if you feel dizzy or faint due to heavy bleeding. If the condition is like bleeding through one pad per hour for several hours, okay? Severe pelvic pain, signs of anemia like extreme fatigue, paleness, etc. In these conditions, you should seek an emergency medical attention, okay? Now let's discuss about some special conditions or a special situation. In teenage girls, it often occurs due to immature hormonal axis. It usually improves after some age or with time. In age 35 and up, must rule out endometrial hyperplasia or cancer. In perimenopause age, it is common due to fluctuations in estrogen production. Okay, so that's all about today's video. Thanks for watching. We'll come back with another topic in the next video. Assalamu alaikum wa rahmatullahi wa barakatuh.